Good morning. I am Dr. Albert. We have seen each other before. I've carefully reviewed your MRI scan and cerebral angiogram. Based on the imaging, there's a vascular anomaly in your brain that we need to discuss in detail.
是什么异常？我需要担心吗？情况严重吗？
You've been diagnosed with an arteriovenous malformation, or AVM. It's a rare vascular disorder where arteries are directly connected to veins without the usual network of capillaries in between. This creates a high-pressure system that can be dangerous.
为什么危险？是不是我的脑子有可能出血？
The biggest risk with an AVM is rupture, which leads to intracranial hemorrhage. In simple terms, if the malformed vessels burst, it can cause bleeding in the brain, which may result in stroke, brain damage, or in severe cases, death.
为什么现在才发现？我都40多岁了，之前为什么没发现？
AVMs can remain asymptomatic for years. In many cases, people live for decades without symptoms. Sometimes, they're only discovered incidentally, like in your case, when people start experiencing headaches, seizures, or neurological changes.
我在 MyChart 上看过那些磁共振和血管造影图像，但我完全不知道自己在看什么，全是一些黑白线条。你能解释一下结果显示什么吗？
According to the angiogram, your AVM measures approximately 2.5 centimeters in diameter and is located in your left temporal lobe, which is the area of the brain responsible for language comprehension and auditory processing.
有多危险？会破裂的几率有多高？
The general risk of spontaneous rupture in an AVM is about 2 to 4% per year. However, if it has already bled before, that risk increases. Other risk factors include deep brain location, associated aneurysms, and high flow shunting.
我觉得我应该没有出过血，至少我没什么印象，这样风险会不会低一点？
That's good news. Being unruptured means you have more time to consider treatment options and make informed decisions. But we still have to weigh the risks of rupture against the risks of intervention.
那实际有哪些治疗选择？
Based on your specific case, I would recommend stereotactic radiosurgery. It's the least invasive option, and because your AVM is moderate in size and not too deep, it responds well to targeted radiation. It may take time to work, but it avoids the risks of open brain surgery. That said, we'll still have our neurosurgical team review everything before we finalize the plan.
在治疗期间，我需要吃药吗？
Yes, we would recommend taking anti-epileptic drugs to control seizures, especially since the AVM remains active during the latency period. Your neurologist would monitor your response and adjust the dosage accordingly.
这些治疗有没有副作用？比如记忆力下降或者性格变化？这些治疗有没有副作用？比如记忆力下降或者性格变化？
All treatment that involves the brain carries some risk of cognitive side effects. Possible effects may include short-term memory problems, fatigue, mood swings, or difficulty concentrating.
谢谢你解释的这么详细。我虽然觉得信息有点多，但真的很感激你这么耐心清楚的讲解。
It's completely normal to feel overwhelmed. This is a complex diagnosis, and it's okay to take your time to process the information.
真的非常感谢你，医生，你解释得很清楚，让我安心了很多。